After receiving the chemotherapy, I would say it's my estimation about a 75% reduction in the tumour size. It's been quite remarkable. And I've been feeling very much better than I was before. I was extremely tired. My name is Lorraine Oldsthorne. I'm from Perth in Western Australia. I'm here at the Modern Hospital in Guangzhou to receive breast cancer treatment. I discovered my problem in June of last year, 2024. I had an accident and I damaged my breast, I bruised it. And following that, I got an abscess. I went to the doctor numerous times, but they said, just have an ultrasound, it'll be fine, don't worry. Over time, over the coming months, I continued to go to the doctors, but the abscess continued to grow. Then it burst, and then I got bleeding and stuff. I went into a major hospital in Perth. They did biopsies, they did PET scans, CT scans, all kinds of tests. They didn't actually give me a diagnosis until nearly the end of the year. And at that stage, they told me that it was terminal, they couldn't help me, and that I would only need palliative care. And that was when I looked for alternatives. After we were given that diagnosis and there was no other options, we started to look for options. So we Googled revolutionary treatments in cancer, and then this hospital came up. We emailed the hospital to find out what treatment you offer and if you thought you could help me. With speaking with the doctor before making the decision, sending the records, the doctor appeared very thorough and very competent and very committed. It made a very good impression, and I thought these people are worth giving a go and dealing with. The other thing that set the Modern Hospital in Guangzhou apart is the range of treatments that they were able to supply. After checking on Google, other clinics offered some treatments, but the widest range of treatments and the different cutting-edge treatments were mainly or only available here. So that was another important factor in making the decision. I was having bleeding problems, so I had problems with my kidneys and problems with my heart caused by the bleeding problems. And the hospital sorted all of those issues out for me prior to receiving any treatment, which was very good because I'd received none of that, not even a mention of it in Australia. And then I've had, so far, I'm just on my third round of chemotherapy, which is just a single trip into the theatre as opposed to a week or more that you would suffer in Australia. So the chemo hasn't been the same confronting process that it would have been in Australia. So I've been very, very happy with the treatment I've received. After receiving the chemotherapy, I would say it's my estimation about a 75% reduction in the tumour size. It's been quite remarkable. And I've been feeling very much better than I was before. I was extremely tired. I'd also like to say that I'm very impressed by the nursing staff in the hospital. They're extremely well trained, very polite, and they are a great aid in your care while you're in the hospital. The doctors were very, very transparent about the treatment that I was to receive. I was very appreciative of quite a long consult in the doctor's office with a full viewing of all of the x-rays and the records and having everything explained to me. That really does give you a lot of confidence to move ahead with the treatment that you're about to receive when you know exactly what's going on and what to expect. I have been extremely fortunate with my family members. Without them, I wouldn't have ended up here because I simply wasn't well enough by the time that I got the diagnosis. If I'd received it earlier on, then I was still capable of doing things, but as time progressed, I became unwell. So I was not in a fit state to really be researching and finding the Modern Hospital. But with the support of my daughter and my son, I was fortunate enough to be brought here and receive the wonderful treatment that I have. I would just like to say a really big thank you to my children for their support in my illness, without which I probably wouldn't be here anymore. So I'm a very, very lucky lady. There was a large number of other patients who were also in there who had been diagnosed with cancer and had been given the same hopeless diagnosis. What I would like to be able to do with the information I have now is speak to those people and say it's not hopeless. There is really positive treatment, there is cure, there is hope. It's a matter of finding the right place and the right treatments. And if there's something that I could do, that would be what I would do moving forward from here.